The most dangerous blood pressure reading is often the one that feels normal. That is the strange part. Your blood pressure can be high for years without giving you a dramatic warning. No chest clutching, no obvious pain, no sudden signal that says, your arteries are under too much pressure. You can feel fine while your blood vessels are working harder than they should. That is why blood pressure is not just a number on a cuff. It is a pressure message from the entire circulatory system. It is telling you how hard your heart is pushing, how tight or relaxed your arteries are, how much fluid your body is holding, how your kidneys are managing salt and water, how your nervous system is reacting to stress, and how much resistance your blood has to push through. Think of your body like a living water system. Your heart is the pump. Your arteries are the flexible pipes. Your kidneys are the pressure control filters. Your blood is the fluid moving through the system. And your blood pressure is the force inside those pipes. If the pump pushes harder, pressure can rise. If the pipes become narrower or stiffer, pressure can rise. If the body holds extra fluid, pressure can rise. If the pressure control system keeps getting stress signals, pressure can rise. So the real question is not simply, is my blood pressure high? The better question is, why is my body needing this much pressure to move blood? First, what blood pressure actually means. Blood pressure is the pressure of blood pushing against the walls of your arteries. That pressure is written as two numbers. The top number is systolic pressure. This is the pressure when your heart squeezes and pushes blood out. The bottom number is diastolic pressure. This is the pressure when your heart relaxes between beats. In the water system analogy, systolic pressure is the surge when the pump fires. Diastolic pressure is the pressure still left in the pipes between surges. Both matter. If the top number is high, the heart may be pushing against too much resistance, or the arteries may be too stiff to absorb the pulse smoothly. If the bottom number is high, the arteries may be staying under too much pressure, even when the heart is resting. A healthy system does not need constant extreme force. It needs enough pressure to deliver blood, oxygen, and nutrients to the brain, kidneys, heart, muscles, and every living tissue, but not so much pressure that the pipes are being damaged day after day. For that is the hidden balance. Too low, and blood may not reach tissues well enough. Too high, and the system gets worn down. Second, blood pressure changes all day. One reading is a snapshot. It is not the whole movie. Your blood pressure can rise when you walk fast, climb stairs, drink caffeine, feel anxious, sleep badly, eat a salty meal, smoke, use nicotine, feel pain, get sick, or sit in a cold room. It can also change with posture, hydration, time of day, exercise, medication, and how the measurement is taken. That is normal. Your body is not supposed to have the exact same pressure every minute. If you stand up, your pressure control system has to adjust, so blood still reaches your brain. If you exercise, your muscles need more blood flow, so the pump and pipes respond. If you are stressed, your nervous system may prepare the body for action, tightening blood vessels and increasing pressure. In the water system analogy, the pump and pipes are always adjusting to demand. The problem is not that blood pressure rises sometimes. The problem is when pressure stays too high too often, even at rest, even when the body is not asking for extra force. That is when a temporary adjustment can become a chronic strain. Third, high blood pressure is often silent because arteries do not scream early. This is one of the most important things to understand. Many people expect high blood pressure to feel obvious. They imagine headaches, dizziness, pounding, or chest pain. But high blood pressure often has no symptoms. Why? Because blood vessels can tolerate pressure quietly for a long time. They do not always send pain signals when they are being stressed. The damage can happen slowly, inside the vessel wall, inside the heart muscle, inside the kidneys, inside the brain's blood supply. In the water system analogy, imagine a house with water pressure that is too high. At first, everything still works. The shower runs, the sink turns on, the pipes do not explode immediately. But over time, The pressure strains the joints, valves, and weak points. That is what chronic high blood pressure can do to the body. It can make the heart work harder. It can damage artery walls. It can increase the risk of heart disease and stroke. It can strain the kidneys. It can affect blood vessels in the eyes and brain. And because you may feel fine while this is happening, measurement matters more than feeling. You cannot reliably sense blood pressure just by mood or energy. You have to measure it. Fourth, the arteries are not just pipes, they are living tissue. This is where many people misunderstand blood pressure. They think pressure is only about the heart pumping too hard. But arteries matter just as much. Healthy arteries are flexible. When the heart pumps, they stretch slightly and absorb part of the pressure wave. Then they recoil and help keep blood moving smoothly. But arteries can become stiffer with age, long-term high pressure, smoking, diabetes, kidney disease, inflammation, and other factors. When arteries become less flexible, they cannot absorb the pressure wave as well. So the same heartbeat can create a higher pressure. In the water system analogy, flexible pipes soften the pump surge. Stiff pipes transmit the force more harshly. That is why blood pressure is not just a heart problem. It is a heart and artery problem. The pump and the pipes work together. If the pump pushes harder, pressure rises. If the pipes narrow, pressure rises. If the pipes stiffen, pressure rises. If the fluid volume increases, pressure rises. And if all of these happen together, the system can become overloaded. Fifth, your kidneys are pressure control organs. Most people do not think of the kidneys when they think of blood pressure. But the kidneys are central. Your kidneys help regulate how much salt and water your body keeps or removes. Salt and water affect blood volume. Blood volume affects pressure. If the body holds more fluid, there is more fluid in the pipe system. More volume can increase pressure, especially if the arteries are already tight or stiff. Your kidneys also interact with hormones that influence blood vessel tightening, fluid balance, and long-term pressure control. In the water system analogy, the kidneys are not just filters, they are pressure managers. They decide how much fluid stays in the system and how much gets drained out. That is why kidney disease and high blood pressure are so closely connected. High blood pressure can damage the kidneys. Kidney problems can raise blood pressure. It can become a loop. This is also why salt affects some people more strongly than others. Sodium can lead the body to hold more water, increasing blood volume, but the response is not identical in everyone. Genetics, age, kidney function, diet pattern, and other health conditions all matter. The simple version is not, salt is the only cause. The more accurate version is, salt can increase pressure in many people because it can increase fluid load and vascular strain, especially when the rest of the system is already under stress. Sixth, stress can raise pressure, but stress is not the whole story. When you are stressed, your nervous system can shift into a more activated state. Heart rate can rise, blood vessels can tighten, hormones can signal the body to prepare for action. In the short term, this is useful. If you need to escape danger, your body wants blood moving quickly to the muscles and brain. But modern stress often does not end with physical action. It ends with sitting, scrolling, worrying, working late, sleeping poorly, and staying tense for hours. So the body keeps sending pressure signals even when the pipes do not need emergency force. That can push blood pressure up temporarily. But stress alone does not explain all high blood pressure. Food pattern, sodium intake, physical activity, sleep, body weight, kidney function, alcohol, smoking, diabetes, genetics, medications, age, and social conditions can all contribute. Stress is one valve in the system. It is not the entire plumbing map. Seventh, measurement can lie if the setup is wrong. This is a big one. A blood pressure reading can be wrong because of how it is taken. If the cuff is too small, the reading may be falsely high. If your feet are dangling, your back is unsupported, your arm is not at heart level, or you are talking during the measurement, the number can shift. If you just exercised, smoked, used nicotine, drank caffeine, rushed in from traffic, or felt anxious, the reading can be higher than your true resting pressure. This does not mean high readings should be ignored. It means they should be measured properly. Sit quietly. Support your back. Keep your feet flat. Use the correct cuff size. Place the cuff on a bare arm. Keep the arm supported at heart level. Do not talk during the reading. And look for patterns across repeated readings, not one emotional snapshot. In the water system analogy, you do not judge the whole house pressure by checking the pipe during a sudden pump surge. You check carefully, under consistent conditions, and look for the average pattern. That is why home monitoring can be helpful for some people, especially when guided by a clinician. 8th, high blood pressure does not have one cause. This is the mistake that creates bad advice. People want one villain. Salt, stress, weight, age, genetics, caffeine, lack of exercise, but blood pressure is usually a system problem, not a single cause problem. For one person, the main driver may be kidney disease. For another, it may be sleep apnea. For another, it may be high sodium intake plus low potassium-rich whole foods. For another, it may be artery stiffness and aging. For another, alcohol, smoking, diabetes, chronic stress, medication effects, or family history may be part of the pattern. And for many people, several of these stack together. A slightly stiffer artery, a little extra fluid retention, poor sleep, high stress, low activity, more sodium than the body handles well, a genetic tendency. Each one may add a little pressure. Together, they can keep the whole system running too high. That is why quick fixes fail. A single food cannot repair an entire pressure control system. A viral trick cannot replace medical care. A supplement cannot erase artery stiffness, kidney regulation, sleep apnea, diet pattern, and genetics all at once. Blood pressure needs a system approach because blood pressure comes from a system. 9th, what actually helps the system? The goal is not to fear your blood pressure. The goal is to reduce unnecessary pressure on the pump, pipes, fluid system, and control signals. For many people, a DASH-style eating pattern can help. More fruits, vegetables, beans, lentils, nuts, seeds, low-fat dairy if tolerated, and minimally processed foods, with less sodium and fewer heavily processed foods. Reducing sodium can help many people because it can lower fluid pressure in the system. Regular physical activity can help because it trains blood vessels, supports heart function, improves metabolic health, and can lower resting pressure over time. Weight management can help when excess body weight is contributing to pressure load. Limiting alcohol can help. Not smoking and avoiding nicotine can help because nicotine and smoking can strain blood vessels and the heart. Better sleep matters, especially if sleep apnea is present. Managing stress matters, not because stress is the only cause, but because the nervous system is part of the pressure control network, and medication can be necessary and protective for many people. Medication is not a moral failure. It is one tool for reducing dangerous pressure when the system needs help. The dangerous move is stopping or changing blood pressure medication without a clinician because the numbers look better for a few days. If the pressure is controlled because the medication is working, removing the medication can let the pressure climb again. 10th, when blood pressure becomes urgent. Most high blood pressure is managed over time with repeated readings and medical guidance. But some situations need urgent care. If a very high blood pressure reading comes with chest pain, shortness of breath, severe headache, confusion, weakness or numbness on one side, fainting, vision loss, severe dizziness, or trouble speaking, that is not a wait-and-see situation. If high blood pressure happens during pregnancy, it needs medical attention because pregnancy-related blood pressure problems can be dangerous. If you have kidney disease, heart disease, diabetes, stroke history, or you take blood pressure medication, your target and treatment decisions should be guided by a qualified clinician. Do not use a video to diagnose yourself. Do not start, stop, or change medication based on a video. Use the video to understand the system. Use medical care to manage your personal risk. Final picture. Your blood pressure is not just a number. It is the force inside a living water system. Your heart is the pump. Your arteries are the flexible pipes. Your kidneys manage fluid and salt. Your nervous system adjusts pressure during stress and demand. Your hormones influence vessel tone and fluid balance. Your lifestyle and health conditions shape the load on the entire network. The top number shows pressure when the heart pumps. The bottom number shows pressure when the heart rests. A single reading is a snapshot. Repeated readings show the pattern. High blood pressure is dangerous partly because it can feel normal while the system is under strain. So what is your blood pressure really telling you? It is telling you how hard your body is working to move blood through the system. It is telling you whether the pump, pipes, filters, fluid, and control signals are staying in balance. And it is reminding you that silence is not the same as safety. You do not need to panic about one number, but you should respect the pattern. Measure correctly, look at trends, protect the pipes. Support the pump. Work with a clinician when readings are high, symptoms appear, pregnancy is involved, or medication is part of the picture. Because the goal is not just to lower a number. The goal is to reduce the pressure your body has to survive every day.